country in the world is facing one or more than one form of undernutrition in their population. Women, infants, and children are particularly vulnerable to undernutrition. The latest data from WHO, in 2020, globally, we still have over 150 million children under 5 are stunting. This means their development in height are much lower than where they should be. This could have severe impact on their later life development. My name is Sheng Qi, so I work at the School of Pharmacy at the University of East Anglia. I'm a pharmaceutical scientist. I'm very passionate about developing technology and translating technology which can meet the unmet need clinically for patients. In September 2019, my colleagues and I were lucky enough to secure a Global Challenges Research Fund translational project, GRTA for short. The overall project is called Meeting the Sustainable Development Goals, and my own sub-project is centered on tackling child malnutrition. This project is focused on developing affordable and tailored for children supplements to tackle child malnutrition issues. Once we identify the region within the world are in need of such low-cost, affordable children nutritional supplements, we were out looking for partners. And what I realized is actually many of my past PhD students are scattered within this region. As an example, Champ graduated with his PhD a few years ago. He returned to his homeland, Thailand, and Champ now is working as a lecturer in Chiang Mai University. Sam graduated with her PhD many years ago. Sam came to UK for her PhD with her government scholarship. Once she finished her PhD, she returned to Malaysia to carry out being a leading scientist there. Also working on the project is Sam's colleague, Gita, whose research is mainly focused on the identification of childhood nutrition and the impacts of undernourishment on childhood development. In Jordan, we have Lorena and Alberto. They both were PhD students when I was lecturing at the start of my career. And they are now working in Jordan as a leading academic scientist, and they're working very closely with the regional pharmaceutical industry.
After we have gotten this sponsor from this GRTA, I have made a trip down to Kuala Lumpur to meet the Ministry of Health to understand further what is the local needs. And I come to understand that even though we are a very hot country with plenty of sunshine, that we have faced some deficiency in vitamin D. Okay, together with it is vitamin A and some iron deficiency, and the emphasis of Ministry of Health has been on the indigenous community, especially those below 5.
We're targeting vitamin D and iron deficiencies. This is because both these deficiencies, micronutrient deficiencies, they impose significant public health issue in Jordan.
The targeting vitamin that we are thinking is B1, B2, B3, vitamin C, calcium, and iodine.
In Jordan, actually, in a recent study in 2015, they found out that 15.6% of the preschool children aged below 5 years, they suffer from vitamin D deficiency, and 56.5% they suffer from vitamin D insufficiency.
So these vitamins, they are very important to the growing body of the children?
Vitamin D, it's really important for the skeletal health, for calcium absorption and prevention of rickets. So you can see that the deficiency in such a vitamin could really impose or pose a serious public health issue. And when it comes to iron is another micronutrient deficiency in Jordan. And you might know that usually iron is associated with iron deficiency anemia. And this anemia in children, it impairs their growth and it decreases their appetite. It lowers the resistance to infectious diseases. So again, it poses a significant public health issue that we had to deal with.
With the increasing rates of malnutrition and including obesity in children and young people globally, we often hear questions such as, how is it that we still have this problem in this 21st century? And why is it very common among certain population?
And this is a good question because it's a bit surprising that in Jordan we have a vitamin D deficiency, because the major factor of vitamin D deficiencies are known to be poor diet, poor supplementation, and poor exposure to sunlight. And in Jordan, we have a lot of hours of a lot of days of sunlight throughout the years. Just to give you some numbers, in Amman there are more than 330 days of sun per year. So it's quite strange that there is a problem with vitamin D deficiency. But actually, there are some possible other causes despite this. For example, some cultural limitations, so people basically don't get enough exposure to light, although we have a lot of days of sun. Also, there might be also a possible genetic cause in the Middle Eastern population that is causing this vitamin D deficiency.
Most forms of undernutrition are somewhat visible, and this can be seen as in children being thin or stunted or even being obese. Nutrient deficiencies or micronutrient deficiencies are often referred as hidden hunger because unless they have any symptoms or signs, we don't really detect them. Far too many of our children and young people are not getting the diets they need, and this subsequently undermines their capacity to grow, develop, and learn to their fullest potential. But the most basic root cause of this is poverty. As a result, low and middle income countries have the highest burden of micronutrient deficiencies. However, this even exists in certain population groups in the higher income countries. So not to say they don't have this problem, they do have this problem, but probably at a very low scale. But like poverty, undernutrition and micronutrient deficiencies often occur as part of an intergenerational cycle. So during pregnancy and lactation, there are increased macro and micronutrient requirements. So pregnant mothers without optimal nutrient or nutritional intakes may have children with suboptimal nutritional status, including they may have impaired physical and mental development, and setting the infant on a deleterious course of stunting or increased chances for infection and developmental delays.
Okay, this product is plans to being developed by electrospinning, a rather new technology in the local pharmaceutical industry. At least we have very less, products has been commercialized on using this technique. And how is it going to make a difference? Because we are planning to actually develop a formula which is instantly dissolvable in the oral cavity. Okay, so hopefully it can solve the problem of difficulty in swallowing among the children or even among the geriatric. So how is it making a difference? We will adopt a very new manufacturing methods, and that particular dosage form can actually be applied to any other pharmaceutical active. So we hope that this has been a prototype for us, okay, especially as a supplement, but it can actually bring and to actually develop some others formula, like even some active drugs and things like that, and that will truly make a difference in the pharmaceutical industry itself. And to our local community, because this is a supplement, we hope that it can solve or at least assist the problem of malnutrition among the indigenous community. And this is where we are actually aiming to use the local ingredient, which is palm oil, which is rich in vitamin A, as our main ingredients for our product developments.
I think they're gonna like this project because of after we finish this project, we will organize a workshop to do the technology transfer, like how to make the gummy and all the recipe. So we train them how to make the gummy, and then after that, so they can try to change their recipe to make their own recipe. Like for our project, it can be just the prototype, and then they can alter to make their own recipe of the gummy by using their local source, like the juice, or maybe using the honey instead of the sugar syrup.
Actually, when we started the project, we had certain priorities that we wanted to fulfill. First of all, we wanted to create a product that was attractive for children. At the same time, it had to be easy to be manufactured and to scale up. So what it means, not only easy to be produced in the small scale, but also at industrial scale. And you must plan this from the beginning of the formulation. Also, we want the materials to be ideally locally sourced, so in Jordan. The manufacturing should be in a company in Jordan, and also the product should be inexpensive. So we had many priorities that we had to fulfill, and it was quite difficult to find a dosage form that will fulfill all these priorities. So for example, just to give you an idea, we started to think about gummies because they're very attractive for children, but then we found no company in Jordan that could produce using GMP the product in Jordan. Also, we didn't have locally sourced materials. The process of producing gummies is quite expensive, so that was a dead end for us. Although we wanted to produce gummies, we couldn't. So in the end, we found that the best compromise we can say that we could find was the chewable tablets. Why? Because somehow we are ticking all the boxes in the sense that they are still very attractive for children, inexpensive. Us as a researcher, we have a lot of experience with tablets, so we can really put our technical experience in the process. It is relatively simple to scale up, and we have a local manufacturer that can produce our tablets. So in the end, we went for chewable tablets as a type of dosage form.
Aligned with the suggestion by Ministry of Health, this formula will be aimed at the indigenous community.
Okay, so this formula actually targets preschool and primary school children.
We aim at all the children in every local communities because of after we do the technology transfer, the recipe will go to the local community so they can make the gummy of their own local source and then make their own product.
We were aiming to get contact with these age groups by visiting schools, developing leaflets, distribute them to those target groups. What we're thinking now that maybe we will be developing electronic versions of the leaflets and try to send them through schools intranet and maybe set meetings with the teachers, children, parents. Meetings with the NGOs is another important factor for bigger dissemination. We're hoping to meet with policy makers and see if they can actually take this product and make it available basically for free for like for children in order to have a bigger impact and actually really help combating vitamin D and iron deficiency in Jordan.
We have initially planned to reach the community through, our yearly health check that's organized by the School of Pharmacy USM. But this activity has been stopped because of this pandemic hit. So current plan is we will be organizing a very small trip, okay, with smaller number of people and volunteer to this community. And we will still reach them physically and to distribute the products that we have been developed and to assist this community.
Well, I would expect some hesitation to this supplement because this is not something that we normally do in most of occasion. Most of time we encourage our people to consume foods, as in foods to improve their nutritional status, and this is what our government, Malaysian government, has been doing as well. They give advice, they give food aid, and they give specific programs to those people who are malnourished, those children who are malnourished, to their parents specifically. And so in that case, to ask them to take something as in supplement, and this would be a challenge because it's something not something out of norm. So education, advice, counseling in this case would be really, really beneficial.
So COVID-19 had made it much more difficult for us to access the laboratories, to contact local manufacturers or approach even regulatory bodies and schools, because this project is not only technical, it also was supposed to tackle social aspects in order to have a bigger impact. Unfortunately, this has been a big challenge during the pandemic.
Pandemic has affected every single partner in very different ways. Every single country has their own restrictions and rules which change on a weekly basis. This made our researchers are very difficult in terms of working in the lab. However, all the partners has worked really hard try to minimize the delay on the progress of our lab research. It also impact on the communication between the partners. Our originally planned in-person conference of the project, now we had to change it to online. But the online version actually worked really well. And we find online communication is very efficient and effective, and we are using it a lot now. The dream outcome of this project for me would be the formulation and the technology we developed through this project can soon be seen on the market as a real product and reach the children who are needing them. Also on a personal level, I really hope the researchers and the scientists who are involved in this project can take away the skills they developed through this project in terms of translating science and technology into real-life product.